Management of acute pain. So, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Many factors influence the feeling and emotion of pain, and these factors vary from person to person. Pain is what the patient says it is. Acute pain, as opposed to chronic pain, is defined as lasting for less than 3 months and is due to noxious stimuli from identifiable causes such as trauma, surgery, or acute illness. The management of acute pain must be individualized to each patient and should include analgesia as well as treatment of the underlying condition. Special attention must be given and precautions taken in providing pain relief in children, the elderly, pregnant women, as well as those with concurrent hepatic or renal disease, and those who are opiate tolerant or have a history of substance abuse. The causes are traumatic musculoskeletal injury, surgery, burns, labor and delivery, headache, sickle cell crisis, myocardial infarction, acute abdomen, for example, acute pancreatitis, joint inflammation, and others. The symptoms and signs and also investigations depend on the underlying cause. Main treatment objectives are to resuscitate the patient if necessary, relieve pain, to treat any underlying disorder. The non-pharmacological treatment: you place affected parts in most comfortable position where appropriate, and elevation of affected parts where indicated, splinting when indicated, cold or warm compresses where indicated, and also reassurance. Pharmacological treatment: you give paracetamol, non-steroidal anti-inflammatory drugs, opioids, nerve blocks with local anesthetics, and multimodal treatment. The paracetamol or acetaminophen in adults, we give oral 0.5 to 1 gram 6 hourly with a maximum of 4 grams per 24 hours, and for adults with body weight less than 60 kilograms, and the doses, with adults with body weight less than 60 kilograms, you give 15 milligrams per kilogram 6 hourly with a maximum dosage of 60 milligrams per kilogram per 24 hours. So for acetaminophen or paracetamol rectal, you give 1 gram 6 hourly with a maximum of 4 grams in 24 hours. For adults with body weight less than 60 kilograms, the dose is 15 milligrams per kilogram 6 hourly with a maximum of 60 milligrams per kilogram per 24 hours. For paracetamol or acetaminophen IV, that's intravenously, should be given slowly over 15 minutes. There's 1 gram 6 hourly with a maximum of 4 grams per 24 hours. For adults with body weight less than 60 kilograms, the dose is 15 milligrams per kilogram 6 hourly with a maximum of 60 milligrams per kilogram per day. Pediatric doses: oral, for children, you give 15 milligrams per kilogram 6 hourly with a maximum of 60 milligrams per kilogram in 24 hours. And for neonates, you give 10 to 15 milligrams per kilogram 8 to 12 hourly with a maximum of 30 milligrams per kilogram 24 hours. Rectal, the same as oral dose, but a loading dose is given first dose only. A loading dose for children and full-time neonates is 30 milligrams per kilogram. IV should be given slowly over 15 minutes, and for children with body weight more than 10 kilograms weight, you give 15 milligrams per kilogram 6 hourly with a maximum of 60 milligrams per kilogram 24 hours. In children with body weight less than 10 kilograms and above the age of 2 months, you give 7.5 milligrams per kilogram 6 hourly, a maximum of 30 milligrams per kilogram of 24 hours. Okay, so for non-steroidal anti-inflammatory drugs, that's NSAIDs, they should be used with caution. Before starting any patient on NSAIDs, you must make sure the patient is not likely affected by the adverse effects of the NSAIDs. So some of the adverse effects of NSAIDs are exacerbates peptic ulcer disease, causes platelet dysfunction, affects renal function, decreases renal blood flow, triggers bronchospasm in some asthmatic patients, causes fluid retention. Thus, NSAIDs should not be given to several groups of patients, including patients with peptic ulcer disease, patients with coagulation or bleeding problems, patients who are at risk of postoperative bleeding, for example, tonsillectomies, and patients with impaired renal function or patients who are at risk of going into renal failure, for example, septic patients, patients with heart failure, pregnant women, particularly in the third trimester, as it causes early closure of the patent ductus arteriosus. Also, should be used with increased caution in the elderly patients. So there have been concerns about cardiovascular safety of the COX-2 selective inhibitor group of NSAIDs. So the recommendations are that this group of drugs should not be given to patients with ischemic heart disease or cerebrovascular damage. So in adults, give diclofenac oral 25 to 50 milligrams 8 hourly or 75 milligrams 12 hourly, or rectal 50 milligrams 12 hourly or 100 milligrams 18 hourly, or IM 25 to 50 milligrams 8 hourly or 75 milligrams 12 hourly with a maximum of 150 milligrams per day. Can give ibuprofen oral in adults 100 milligrams 6 to 8 hourly, in children 20 to 30 milligrams per kilogram daily in 3 divided doses with a maximum of 1.2 gram per day. Opioids, these are used for severe pains. So you give tramadol in adults oral 50 to 100 milligrams 4 to 6 hourly with a maximum of 400 milligrams daily. You give petidine IM in adults 25 to 50 milligrams, approximately 1 milligram per kilogram 4 hourly, and lower dose in the elderly. In children, you give 1 milligram per kilogram with a maximum of 50 milligrams 4 hourly. If petidine IV in adults 25 milligrams repeated if necessary with caution. You give morphine IV in adults 1 to 2 milligrams, boluses repeated if necessary with caution, and morphine IM in adults 5 to 10 milligrams 4 hourly. In children, 0.1 milligrams per kilogram with a maximum of 5 milligrams 4 hourly. So nerve blocks with local anesthetic agents, and give lidocaine and PrivateCare for multimodal treatment. Give paracetamol and opioid, paracetamol and NSAID, or paracetamol and NSAID and an opioid. So different groups of drugs can be used together to treat pain, and this increases the effectiveness of pain relief, as there is a limit to the doses of each drug that can be given, and this limits its effectiveness when used alone. Okay, so referral criteria: if underlying condition does not improve or pain relief is not achieved with recommended doses, you refer appropriately.